So, more than 90% of the patients in any clinic are only these 4 patients. So, all you need to know about these 4 problems to make a diagnosis. There are some rare problems which are in red. They occur, they happen, but they are rare. So, as long you just need to be aware of it. And then there is instability, which we are not talking about today because the domain is senior age, as 40 plus patients or rotator cuff and associated diseases. So when this a 40 plus or a 45 plus patient, जो कि हमें नहीं पता कि rotator cuff disease है या नहीं है, ये patient when that comes to my clinic, this is the first question I'm focusing on. What exactly is the main symptom of this patient? And these are the only 3 symptoms. Patient may try to confuse you, डॉक्टर साहब उस दिन गिर गए थे, ये हुआ था, फिर वहाँ पे चिकनगुनिया हुआ था, तब फिर हुआ, so on and so forth. But try to focus and find out, elicit, what is the dominant symptom? Is it pain? Is it stiffness? Or is it weakness? And beware. If patient tells you that frozen shoulder ho gaya hai, don't take him for it. He is actually trying to mislead you because vast majority of common general public, as well as of quite a few orthopedic surgeons, have a habit of labeling every shoulder problem as a frozen shoulder. So if you are going by his diagnosis or his reading of the disease, you are not doing yourself any good. So what exactly is the dominant symptom? As I said, the 4 major problems and what are the dominant symptoms in these. In cervical pain, in cervical symptoms or cervical problems, spondylosis, postural problems, blah, 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 there is pain, but there is neck stiffness. Neck movements are tender or painful. When there is a frozen shoulder, there is pain, but there is shoulder stiffness. And we'll talk about it a little later, in a little bit in detail. In a pure rotator cuff disease, while there is pain, while there will be a little bit of stiffness, the main problem is weakness. Of course, the AC joint problems, as I said, is rare and there's a localized pain. We will not talk much about it. All you need to do is just go behind the patient, feel both his AC joints, put almost equal pressure on both the AC joints, and if the affected side is painful, it is AC. MRI may say what